Yeah, I think
Also, you're able to stream?
Yeah, I'm live now.
Okay, so you're streaming on your YouTube on your YouTube account, yeah?
Yes, it will be my YouTube account. That's the problem.
Okay, let me just see. I don't know if StreamYard, that's tricky.
Should I copy the link? Yes.
Yeah, you can copy the link and see if I can attach it to the Raw Cafe account. Let me see. YouTube. Where's YouTube? Where's YouTube Studio? I'm trying to find it. YouTube Music, YouTube. Let me see.
Yes.
Yeah, go live. So, schedule stream. Let me see. Create new.
Is the link still working? Because is the link still working? Because I exited my YouTube.
You
is exited. It still working?
Let me check. Give me a minute. You put it on the chat, right?
Yes.
No, if you
let me know if
it stopped.
Yeah, I
no,
know
it's still.
that. But it's still. Is it still on?
Yes, it's still on, Takalani. The link is still working. I think we may just have to upload it later.
So
you can.
Okay, but you can see. Okay, can you just try to leave the meeting and then go view it, and in 2 minutes just come back and tell me if it's working.
Oh, what's happening? Oh, Takalani, it was working on your end, but I don't know how I don't see a way of copying the link and then linking it to the Raw Cafe. So I think what you might have to do.
Link and then you copy the link and then just paste it on the wall of the cafe or wherever you want it to be seen.
All right, just a minute. Let's go.
Ring, ring, ring.
Hi, Tendo. Thank you so much for joining. We're just sorting out the live stream, so we'll be starting once that's sorted and when everyone else joins us. But thank you so much for joining.
Okay, no problem.
Cool.
Sorry. I'm trying to see where to
Ring.
paste it. Where do I need to paste it?
I think Takalani has actually left the call, Mercy.
Okay.
Yeah.
Okay, what I think with Lara is we might just have to stream it maybe on another channel, then upload it later.
Okay.
Yeah, because
Because
we've
it's
tried
currently
everything.
streaming on her channel, right?
Yeah. So what she can do is just stream or record and then we'll upload later. Because I had to set up all this like way before the meeting. It's a bit tricky to set up Zoom streaming and all that. Especially if your accounts are not all connected. Because I'm trying to find a place to paste the link.
Mm-hmm.
And I can't see one. Let me see. Yeah, I think that's what we'll have to do. So I think with Larry, your set, we'll just have to upload it later.
Okay. I'll also record it on my side when we start so that at least we have the
Yes.
backup. Yeah.
Otherwise, I have to leave you and join the other meeting. So when you have time, I think we can sort all this out, all these Zoom settings and all sorts of like things later. So for future purposes.
Okay, no problem. But thank you so much. I really appreciate it. I think as long as it's streaming and as long as we can record it.
Yes.
Yeah.
All right. So I'll have to leave you now. Bye-bye
Okay,
and all the best.
Thank you, Mercy. Bye-bye.
Hi, Ian. How are you? Oh, you're still muted. I have another meeting, so I'll have to leave you to continue, guys.
Hi,
Bye.
Mercy. Bye.
Hi.
Sorry, I mean to unmute myself and stop my video, and I did it the other way around.
No problem. Hi, Prof. Cooper. How are you?
I'm fine, and you?
I'm good, thank you. We were just sorting out the live stream and everything. We've managed to live stream it, but it's not going to be on the Royal Family YouTube channel for now because of our settings. But we'll at least record it and then like post it on the channel for later. Yeah.
I just have to say hello, Pat. It's nice to see you after a long time.
Hi, Ian. How are you? Nice to see you
good,
too.
Yeah.
Yeah. I'll have to come to Cape Town and we can have a catch up.
Indeed.
Yeah, lots of love to Jackie too.
Will do. You're keeping well.
Yeah, not too bad. Not too bad. Just really
Good.
busy, like you, I suppose.
Yeah. One day I'll slow down.
No, you won't. I bet you won't.
Hi, everyone.
Hi, Ndivuo. How are you?
I'm good, thanks. How are you?
Good, thank you. So I was just speaking to Mercy, and then we said for now it's okay. We'll just live stream it on your account for now, and then we'll also record it. And then once the meeting is done, then we'll be able to upload it onto the Rural Family YouTube channel. So Tendo has arrived. She's one of our panelists for today, as well as Mandisa. So I know Dr. Anna is currently joining as well, and Dr. Asafika. So we're just waiting for 4 more of our participants. Well, 3 more now, because I just admitted Dr. Asafika into the meeting room. But I think if we could all just perhaps wait 5 more minutes before we officially start our conversation for today. Hello, everyone. I think we can officially start our program today. If it's okay with everyone, I'm just going to be recording this session. And to our participants, you have read our consent form, and it's important for us to record this session because all the everything that we'll be discussing today will be part of the data as part of the World Health Organization funded research project that's being run by Prof. Ian. So if it's okay with everyone, I'm just going to start recording this session. All right, so welcome everyone to the South African edition of our Rural Cafe series. My name is Vutlhari Shirinza. I'll be the lead of your cafe today. And the Rural Cafe is honestly just a laid back conversation that we'll just be having amongst young healthcare professionals, and we also have one student on the panel today, but it's really a laid back discussion, and today's topic is about rural proofing. So we're hosting this Rural Cafe to understand what young healthcare professionals understand about the concept of rural proofing, what it means to them, and how you young professionals think that we can improve rural healthcare in South Africa. So as I mentioned, it's a casual discussion. So I hope you have your coffee and your tea or your water juice ready. And yeah, thank you so much for making the time to join us today. We really appreciate it. And we really appreciate your insights into this conversation. So as I mentioned, this is the South African series, and it forms part of a series of rural cafes that have been hosted over the month of February. So we've had one in Africa, hosted in the Africa region, also North America, South America, and today you're part of the South African series. So thank you so much for joining us. As I mentioned, the topic is about rural proofing, and it's part of the World Health Organization funded research project that's being run by Prof. Ian Cooper and his team from the University of Stellenbosch in the Western Cape. So your insight really means a lot to us today. So to kick things off, I'd like all the panel members to introduce themselves, but I know that they'll do a much better job than me at introducing themselves. So please can I ask that everyone turn their cameras on, even if it's just for the first 5 or 10 minutes of our discussion today, just so that we are able to meet everyone. And then please can everyone introduce who they are, where they're from, their occupation, just so that we can get a sense of who's in the room today. And then I'll just wait for everyone to turn their cameras on. Okay, so I will go first. My name is Vutlhari Shirinza. I'm a 5th-year medical student at the University of Cape Town. I also did the intercalated program, which is a degree in biomedical sciences, but I'm currently a 5th-year medical student, and I'm the student representative of the Rural Doctors Association of South Africa, and I'll be your cafe lead today. So I'm very excited to meet all of you. And we'll just do it popcorn style, so whoever wants to go ahead and introduce themselves, please feel free to do so.
Okay, I'll start. Hi, everyone. I am Asafika Mbangata. I'm a medical doctor, currently a registrar in family medicine, doing my last year now. And it's a pleasure to join you today. I hope that we will have a great conversation. Thank you.
Thank you so much, Asafika.
Okay.
I think I'll pick. Cool, lovely.
My name is Tato Mashego. I'm currently doing my community service. I'm a professional nurse, and currently I am based in Durban, in a local township called Inandasi CHC. So I hope this discussion will be very fruitful. Thank you.
Great, thank you so much, Tato. So glad to have you here with us today. Tendo, do you want to go ahead and introduce yourself?
Okay, yes. My name is Tendo Zumba. I am an occupational therapist, and I'm working in Limpopo in a district hospital in Zanin. I've been working here for 9 years now, and our hospital mostly serves rural communities. So it is surrounded by rural communities. So I've been exposed to this for 9 years. So I look forward to this. And I'm also a member of the Occupational Therapy Association of South Africa. So that's also good that I'm here also on behalf of them today.
Wow, nice to meet you, Tendo. I'm sure you'll have so much insight to add to our conversation today, but thank you so much for being part of our panel today. I'll hand over to Prof. Ian.
Sorry, I didn't turn my thing on because I'm actually just here to lurk in the background, but I'm Ian Cooper. I'm Director of Ukwanda Center for Rural Health at Stellenbosch University, and I'm a previous chair many moons ago of RUDASA and a previous chair of the International Working Party and Rural Practice, under which this project is happening with WHO. And I'm here ready just to listen and enjoy, as I've enjoyed the previous cafes. Thank you very much for doing this, Futlari.
That's amazing. I really hope that the South African one meets up to the standards that the other ones have been at. But I really hope that you enjoy this conversation as well. And Divuo, would you like to introduce yourself?
Yeah, sure. So I am Divuo Takarani from Stellenbosch University, Ukwanda Center for Rural Health. I work hand in hand with Prof. Ian Cooper, and I am the research assistant for this project. Just like what Prof. Ian said, we're just here to observe and give you guys a chance to explore. Thank you so much.
Great, thank you so much. And thank you so much for the opportunity as well. I don't think we'd be here if it weren't for you and Prof. Cooper. So thank you so much for all the work that you're doing in the background. And now, Mandisa, would you like to introduce yourself?
Hi, everyone. My name is Mandisa Mzuza, and I am an occupational therapy student at UKZN, and I'm doing my 4th year this year. And I'm interested in community studies, especially in rural health. So that's why I saw it to be part of this today.
Great, thank you so much. Great, thank you so much, Mandisa. I think you're the only student here apart from me. So you have a really big role to play to speak on behalf of all the students, but I know you're going to do amazing. So thank you so much for joining our panel today. And we are still waiting on our other 2 panelists, Joy. But Joy has mentioned that she is having network issues, so she might not be able to join. And our other panelist, Dr. Anna, has just mentioned that, she just got out of work now, so she's still driving on her way home. But once she's able to join, then she'll be here with us today. And then I'd just like to open the floor for other people who have joined us this evening, just for them to introduce themselves. I see we're joined by Pat David. Pat, would you like to introduce yourself as well?
Yes, hi, thank you very much. As you've heard, my name is Professor Pat David. I'm from WITS, and I'm also the immediate past president of OTASA, so I'm glad to hear we have some members on the panel who are OTASA members. And I have a very long-standing interest in rural health and obviously particularly in occupational therapy. And so I'm also here to listen and to learn about what young people think. So thank you very much.
That's amazing. So glad to have you here, Prof. And thank you so much for making the time to join our discussion today. And we're also joined by Isimen Idehen. Sorry for the pronunciation. Would you like to introduce yourself as well?
I am Isimeme Idehen, a medical officer from University of Cross River State in Nigeria. I just want to observe what we are doing in the rural CAF in South Africa. Thank you.
Amazing. Thank you so much for joining us today, Doc. It's very nice to know that we aren't only joined by people from South Africa, but we have extended to the rest of Africa, and we hope other people from other countries are watching us as well. So thank you for your representation here today. We really appreciate it. And last but definitely not least, I see we have someone else who's joined. Unfortunately, I can't see your name because it's under the name Lenovo, but please feel free to unmute yourself and put your video on so that we can also see who we're also joined by today. The person with the name Lenovo, would you mind introducing yourself as well?
Hi, everyone. Apologies. Can you hear me?
Yes, we can hear you.
Okay, apologies for that. My name is Nopinki Chilingisi, and I am calling from Remote Doctors. We are a startup company that developed sort of an app that provides a remote ecosystem for remote treatment. Specifically, one of our target markets is rural patients. So I'm basically here just to listen in and observe.
Wow, thank you so much for joining us, Lupinki. It's really amazing having so many different people who are in rural health, but are serving different sectors of it. So thank you so much for joining our conversation today. We really appreciate your presence. Yeah.
You're welcome.
All right, so now that we know who's in the room, we're joined by professors, occupational therapists, medical doctors, and people in entrepreneurship. I can definitely tell that we have a full house here today, but we're all passionate and are interested in rural health. So I'm very certain that this is going to be such a fruitful conversation today. So as I mentioned, it's quite a casual discussion. So I really hope that you have a refreshment close by to you, but we are expected to finish approximately at 8 o'clock, but we'll see how everything goes, and are really hoping that we can finish before then, but not to cut the conversation short, but just as a possible ETA for people who may have other priorities after our discussion. All right, so we're going to get right into it and kick things off with our first question. I will be, probing some people to answer just to break the ice, because I know it might be quite tempting, to be shy and hold back a little bit, but I'll just be probing a few more questions and probing some people to answer. But please feel free to answer the questions as honestly and as as much as possible. And even though you're not on the official panel, like any of our official panelists, please feel free to also contribute to the conversation. We'd absolutely love to hear what you have to add. And, the more discussion we have, the better it is. So please don't hold back and feel free to jump in as well. All right, so the first question that I have for you all today is, what do you understand by rural proofing or rural impact assessment? What is your understanding of this term? I understand that there are different definitions of it, and we understand it differently, but what do you understand by rural proofing? I think I'd like Tendo to go first, and then everyone else can just jump in as they feel free. So Tendo, what do you understand by rural proofing or rural impact assessment?
Thank you, Bukhari, for putting me on the spot right away. My understanding of rural proofing is how our government system and all the strategies that they put in place, that they should include and also consider those that are in rural settings. The needs, for people in rural settings are different from those that are in urban areas, and every system that is put in place should consider and cover those that are in rural areas. That's what I understand, my take on rural proofing.
Definitely, especially how every system put in place should extend to rural areas, because they sometimes tend to be forgotten. So thank you so much for that. Dr. Asafika, what are your thoughts on rural impact assessment?
So for me, I think it's not necessarily about urbanizing rural healthcare or changing the facilities or the structure itself, but it's more about making healthcare more accessible to people in those remote areas and ensuring that health is optimal, functionally. It's functionally optimal, and that it's adaptable with the changing world and also the global standards of care that keep changing now and then. But just to make sure that healthcare in those facilities and in those areas is also in line with the changing world and it's easily adapting to it. And how do we make this? We make sure that this happens through ensured policies. So this is my take and my understanding of it. So it's policies that are put in place to ensure that healthcare is still affordable, it's accessible, it's adapting, and it's optimal for people who are in these remote areas, and making sure that we are changing with the adapting world and with the standards of care.
I really love that, especially because sometimes you get urbanization in urban areas and then people tend to forget about rural areas. But as you mentioned, we're not trying to urbanize these rural areas, but more, it needs to be in line with the changing world. So I 100% agree with that. Thank you for that. And anyone else have what does rural proofing or rural impact assessment mean to them? What is your understanding of it? Perhaps we can hear from Tato. Tato, what do you think? What does it mean to you?
Okay, I think rural health proofing more has to do with our government making assessments in terms of looking at what a specific rural area needs, what are their cultural and religious beliefs, and the government is going to be putting systems and policies in place that will go hand in hand with what the people of that specific area will be believing in. So that's how I understand rural health proofing, because it is a holistical thing in terms of when we talk about health. It's not only about the physical health, but we'll also be focusing on the emotional well-being as well as their cultural and religious aspect. So that's what I think rural health proofing is. Thank you.
Yeah, thank you so much for that. It just shows that when rural proofing is done, it needs to incorporate like the entire person. So their religious aspect, their physical aspect, their social aspect, and their emotional health as well. So it sounds like you're saying it's a comprehensive tool that needs to be used by government and not just focusing on one aspect. So thank you so much for that. And Mandisa, what do you think as a student? Perhaps you've heard about it. Have you learned about rural proofing yet? Have you ever come across it yet as a student? And what is your understanding of it?
So I've never heard about it before, but I've done my research like from today's topic, and I saw how it's about the government's policy to ensure fairness across all areas so that it doesn't disadvantage rural areas per se. And as like everyone had said before, that it is accessible to all, and it is that is holistic, like how they do in other areas, they should do to rural areas and not compensate because they have a more disadvantaged background.
And it's quite interesting because as a student, I had never come across it as well. So it shows that, you know, it might just be lacking, but this is a great opportunity to promote rural proofing and to promote the knowledge about it. So I'd just like to pick on you some more, Mandisa, but why do you think it's important? Why do you think it's important for government to ensure that rural proofing is done?
I have to think about this one, but I think for health to be accessible, because they, much as people as everyone else, they also require health, they also require fairness as everyone else. So why disadvantage them because of where they come from or because of their socioeconomic status, because they still require the same amount of healthcare. So I believe that it is important to offer the same basis of healthcare to everyone. And yeah.
Yeah, I mean, I really put you on the spot there, but I am understanding why you think it's important, because, you know, we all deserve like equitable, accessible healthcare, regardless of your socioeconomic status. So thank you so much for that. And if I can just toss it to Dr. Asafika, but why do you think it's important? You mentioned that rural proofing is aligning ourselves with the changing world, but why is it necessary? Why can't we just say, okay, urban areas can develop as is and we leave rural areas in the dark? Why is it important that we still ensure that rural proofing is done?
Okay, so I think the most important part or aspect in rural proofing is that it's through policies. Yeah? So anything that is written down has to be implemented and is easily trackable or traceable. So when we don't implement these kinds of policies, then it means rural healthcare can fall through the cracks very easily, and no one will really care about it or follow up to check how far we've gone in improving it and in ensuring that healthcare is actually accessible in those communities. So it's important that we have it so that we have a framework that we are working with that will guide us to sort of give us a map as to how far we've gone and, you know, how far we still need to go and what needs to be changed, what needs to be implemented, what needs to be, how can I put this? How can we better it? Because when we take into context the rural communities, they form 40% of the whole population of South Africa. So that's a huge number of people that we are forgetting about solely because we don't feel that they have a bustling economy like the urban areas, or they are not as developed. But it's actually a huge number of people that is being disadvantaged because we aren't implementing any policies and any frameworks for their benefits in terms of healthcare. So I think it's important that we have these sort of policies in place to protect them, to ensure that everyone gets equitable and equal access to healthcare.
Definitely. Thank you so much. And I think like once something is established in policy, then you can ensure that the correct key players have to implement it. Because once we don't have something down on a policy, it's very hard to implement. So thank you so much for that. But now if we could just think of some examples of rural proofing that are currently happening, perhaps in South Africa and Africa, or even as big as the world. But are there any examples that either of you know of rural proofing that's happening in South Africa rural proofing that's happening in your hospital or in local rural hospitals that you know of? And anyone can feel free to answer. Perhaps if I can pick on Tendo, but have you come across any examples of rural proofing being implemented, or do you know if any that's currently being done?
Yeah. I'm just going to give one example of the primary healthcare system, because I'm not sure if that is what's regarded as, but I think it does fall under the category, because if we look at primary healthcare system, you know, clinics being built in rural communities to serve the rural communities and for them to have access, immediate access to healthcare system. And the other one would be outreach services that we conduct in the hospitals, you know, from hospitals to all the communities, making sure that even those that don't even have the knowledge about their conditions or the special care that they should be receiving, then we take the services to them. So I think it does qualify as rural proofing, because, you know, we're giving them access to health care, and we're making sure also that they have access through clinics. So I think those are two examples that I can give.
Definitely. I definitely think that outreach is like one of the biggest forms of rural proofing, because it ensures that like all people, regardless of where they live, are receiving like equitable services, even though they can't physically go and have access to them. But through us going to them, that's one big way of rural proofing. And does anyone have any other examples they want to add to that?
So I'm not sure if this is like, but the one, but I think it's more linked to the outreach services. Like, where do you see when they have mobile clinics for rural areas? So I think that's one of them.
Yeah, definitely. And Asafika, do you know of any policies perhaps that are being implemented or currently being implemented or in the pipeline that form part of examples for rural proofing?
So an example would be the rural proofing guidelines, which were established in 2015, if I'm not mistaken. So it's just a policy framework to show why there needs to be rural proofing and how it can actually be implemented. Because one of the challenges that was highlighted was the fact that, you know, when you are trying to do something new, a lot of people will have varying views and, you know, polarizing ways of doing things. And you will find that there is no standard level of care or understanding to, like, for example, rural proofing. What we're doing now, we're trying to establish a common understanding of what rural proofing is, so that when we go back into our communities, we all can have a shared understanding and a shared application, possibly through frameworks such as the rural proofing guideline that can, you know, be implemented. So that was one of the highlighted things, to say government may want to come up with policies. Government may want to assist rural communities, but where do you start and how do you do it? And this platform of this nature is one of the ways in which we curtail how these policies are framed in order to assist communities, because that is where the biggest challenge comes in, because you don't know where to start. It's so big, and you know, there are varying views, and you need to marry all these views and come up with one common understanding and one common policy that can be implemented in Limpopo and equally implemented in the Eastern Cape, but curtailed to the needs of those varying communities.
And just a follow-up question on that, who do you think are the key players or people that should be involved in the rural proofing? Do you think it's like government's responsibility? Do you think it's like the clinic's responsibility? Is it the health professionals' responsibility? Who would you think who would you list as some of the key players who should be involved in like implementing rural proofing?
Yeah, that's a very beautiful question, I must say. So I think importantly, when we exclude communities that we want to serve, we are doing an injustice to them. So I think the communities themselves should be forming part of these platforms. That's number one. And then number two, then we can have health professionals who will be delivering these kinds of services in whatever scale, whether it's occupational therapy, whether it's physiotherapy, whether it's the pharmacist in the region or whatever. If you are forming part of the health system, then you should be forming part of a platform of this nature, and then government. But when we delegate everything to government, they don't have a common or shared understanding because they're not working on the ground. They don't know the challenges in full depth. They will assume, and the danger with assuming that you understand what the needs of the people is, or what the challenges faced by the professionals in that space are, is that you will miss them by a huge mile, and you will work tirelessly coming up with policies, coming up with frameworks and all these things, and they're not going to be easily implemented, or they're going to be rejected. And once that happens, then it's a waste of a lot of time and resources on the part of government. So I think it starts with opening up these platforms to the communities themselves to find out, what do you think needs to be changed at this scale, and what can we do to make your life better, or to make health more accessible to you, or to make you more aware of what it is you need to take responsibility for your own health. And yeah, so it's a collective and a collaborative approach that I think will work for us when it comes to these things. But I must highlight that I like what RUDASA, the association, is actually doing in terms of trying to bridge these gaps where government seems to be failing. They have come up, for example, currently, they've come up with a very good plan of, empowering healthcare professionals who are working in rural communities, just to make sure that they're also comfortable and they're confident and they are skilled enough to handle all the conditions that they come across in those rural areas. And at the same time, I think if we could broaden that scope and not have only one association that is busy equipping healthcare professionals in that scale, but like if you have occupational therapists, if you have pharmacists, if you have community health workers, if you have health promoters, if you have policy developers, politicians, all of these people collaborate together, I think a beautiful outcome would come from that.
Yeah, definitely. And I love that you mentioned it's a collaborative effort, because that collaboration definitely has to include the community as well. Because at the end of the day, it doesn't make sense to have a policy that has been developed like from the top, but then when you come down and you now want to implement it to improve the community's lives, they don't see it as necessary, or they're like, no, we never asked for this, or we don't need this. So it's very important that the needs and the policies definitely communicate. And I think all stakeholders have to be involved. So thank you so much for that beautiful answer. And perhaps could someone else just elaborate who they think are the key stakeholders that need to be there? Tato, from a nursing perspective, who do you think are the key players who have to be part of rural proofing?
Thank you. From my perspective, I think the people we serve, it's very, very important to include them as we develop policies, because like Dr. Asafika said, they are the ones who know what they need as a community. They know the challenges that they go through. They know what kind of services they need. They know what kind of an ethnic group that they are, how they behave. So having patients there, it's very, very important in developing our health systems and policies. And then we also, as professional nurses and the other multidisciplinary teams, it's very important also to be part of that, as we are the ones on the ground who first notice any problems. If there is an outbreak of a disease, if there is a trend in a disease or perhaps a symptom, for an example, if there is a number of patients for a specific time that come with presenting with similar symptoms, we are the ones who are firstly gonna pick that up because we spend so much time with the patients. So from us, then it gets reported all the way up to the district level. It goes all the way up to the national level. And then that's where the policies will be developed based on the information that we pick from the ground. So it's also very important for us healthcare professionals to be part of that. And then also to include religious leaders and cultural leaders. It's also important because they live in the community. Some of the community members confide in them in what they need. So for an example, in other aspects like the social well-being of patients, if there are people who are experiencing abuse at home, who are experiencing all sort of the problems, the community leaders and the religious leaders must be part of the stakeholders, because they are the ones mostly who deal with that, and they will have proper insight into how they approach those specific problems at that given time. So that's my view from a nursing side. Thank you.
Thank you so much. I think leadership forms like a very big part of rule proofing. So leadership both in the government sector and the religious sector, even leadership as a health professional, because you definitely are a leader. So I think there's several key players that both of you have mentioned, but it seems like it's a collaborative effort and shouldn't just fall on the shoulders of one stakeholder. So thank you so much for that. And perhaps if I can just ask Mandisa and Tendo, rule proofing is all about securing a positive future for rural communities and making sure that, policies are in place to ensure that they're also taken care of and not just left in the dark. But what do you think should be done to secure a positive future for rural communities? And especially, Tendo, I'd love to hear from you because you've been working with rural communities for 9 years. But what do you think should be done to secure this positive future for rural communities?
Sorry about that. Can you just maybe try and, I think I lost you for a moment there.
Okay, so you've been working in rural communities for 9 years, right? And I think as part of our discussion today under rule proofing, we're trying to secure a positive future for rural communities, right? So what do you think can be done to secure this future, this positive future for rural communities?
Something, I think it's one of the speakers that spoke earlier on. He spoke about the people that are on the ground, more especially nurses, to be exact, and also the community themselves. We cannot do this without them. So I think that needs to be done. The collaboration that we've been talking about is we need to listen to the community members themselves. We need to hear them out, because if we come in and build this thing that we're trying to put on the ground without them, then it will not be sustainable. And one of the things that we need in community-based rehabilitation is sustainability, even in the absence of the professionals or the doctors. So we need community to sustain it and do it even without when we're not there. Maybe just to give of something that is very common these days in our rural communities. If you have a mental health care user in a community that is not known, the condition is not known, and people often mistaken them for criminals, violent, witchcraft, and so, so we are not there sometimes as professionals, but in our absence, what must happen? It is that must stand and protect these people. So that's where we start. That's how we sustain the future of everything that we're trying to do. Before we can even, with our knowledge and everything, we need to start there. We need to start within the community, for the community, by the community, which is, a motto that is used by Wits University so very often in their community-based rehabilitations, to say it needs to be by the community.
Definitely. Like, it sounds like securing a positive future, you have to empower the community so that whatever efforts are done, they're sustainable. But if I can put you on the spot again, like, how do we actually do this? Like, practically, if we wanted to say, okay, we want to ensure sustainability by empowering our community, like, which practical ways what practical things can we do to actually make sure that this is, done?
Okay. I think for one would be when we celebrate our activities in the health calendar, if you check us, we celebrate Diabetic Day, we celebrate World CP Day and all that. If we check the context, where are we celebrating these things? That's probably the first thing. We are doing it in ourselves, on radio stations, on TVs. Mind you, most of those people that we're serving don't have TVs. They don't get to see this. They don't get to have that information. Maybe it's time that we actually went down to them and celebrate these things with them and let them know all those things, that you don't have to hide your disabled child. It's okay. They can go out there. They can go to school. So maybe we can start celebrating and putting health calendar that actually is done in the communities. We have rehab centers and other things. Why do we have rehab centers located in bigger cities and not in rural areas themselves? They don't have transportation to go there, let alone the financial capacities. So why don't we just take it to them as a sign, of the collaboration that we're looking for? And I think, just let the public communicate back to us if we communicate with them. That we could do.
Yeah, and it's so funny because I was looking at the calendar and there's like a day for everything. There's a day for, there's AIDS Day, there's TB, there's this and there's that and there's that. But it's so important. It's interesting, like whether we actually celebrate them or not and where we celebrate them. So that's actually such an insightful comment, that where do we celebrate it? Who even knows that it's World CP Day? What are we doing about it? And how are we making sure that these calendar days are reaching the people that they need to reach? So that's such an insightful comment. Thank you so much for that. And Mandisa, as a student, like, have you seen anything that's being done to secure a positive future for rural communities? Are there any examples that you can think of that are being done by UKZN, that are being done in your region? Like, and especially in line with what Tendo said, like, is there anything that you can see that's being done to actually empower communities in rural areas?
So in my community, I've never seen anything as such, but what UKZN does is we have like a community block where students go into like deep rural areas and implement their therapy there. So I think that's also like a good community outreach or proofing type of thing. But just to add onto the rural proofing security, how do we ensure security, positive security towards that? So I was thinking about how we mentioned that we have to speak to the community members and hear their concerns, what they need and what is beneficial to them. And from there, we shouldn't just stop at just listening to those things. We have to advocate
advocate to a point where they see changes, and also understanding that it's not going to happen overnight, telling them, also being transparent to the community that it's not going to happen overnight, but we will advocate for you guys. And I think from there, they will be able to trust us and be able to come back to us and create a good relationship between the community and the clinicians. So yeah.
Definitely. And as a health professional, you are like their number one advocacy point. And advocating is even as simple as explaining to them like what condition they have. Because sometimes these things get missed in the cracks. But I completely agree with you that advocacy is such an important thing to secure this positive future. I'm just going to hijack Nopinki here and just ask you, as someone who is working directly with rural areas to, improve access to healthcare in the form of in the entrepreneurial route, what do you think is a great way to secure this positive future for rural communities?
Thank you for the opportunity. I think to involve technology companies like ours. For example, we have developed an app that incorporates a sort of the healthcare infrastructure, like everybody, we call it the ecosystem actually. It incorporates the ecosystem that has all forms of health professionals, all forms of health services. We deploy mobile clinics. We provide wearables, we provide all kinds of equipment technologically that can connect to our app. And this is so groundbreaking in the sense that we even collaborate with network companies like to put satellites out there where there's no connectivity. So what really is exciting about this is that it bridges that gap for rural communities in the sense that basically it works via an app where somebody needs to have a mobile phone, but the important thing about ours, they don't even need to have a cell phone, because we would deploy fully equipped mobile clinics out there where people can just walk up and all the technology inputs or integrations are done by a dedicated, say, worker. It can be a nurse that's in that mobile, and the person can have a quality consultation with a doctor while being in the rural areas. So there's a lot that is being done out there in the market with Remote Doctors for Africa, or Remote Doctors for All being one of those companies that are being that want to lead in that space. So yeah, those are some of the things. They don't even need to worry about those things that were at the moment are constraints, because technology can bridge that gap and innovation.
Exactly, technology and innovation. And sometimes, as we mentioned before, we think of rural areas and we think, oh, they're definitely underdeveloped, so let's not take our technology there. But just out of curiosity, what has been the reception by by people who live in these areas on the technology and innovation? What have they been thinking about the startup and the introduction of new technology in their healthcare system?
I think obviously, generally the uptake has not been much, because it's one of the innovations that we're working on, and it's a phased approach. It hasn't hit the ground yet. We are dealing with partners that are sort of corporate, that can sort of use our service as a white label and provide it to their customers. And then as a further phase, then we'll take it to the ground, like to the people themselves directly, but we're not there yet. The way it's going to come through to them at the moment is through corporates that's already working with communities,
Yeah, but as with anything, when you start out, reception can be slow, but I'm very confident that there'll be huge uptake in the technology, and you're doing really, really amazing work, and it must be commended. So thank you so much for all the work that you're doing in these rural areas.
Thank you. In a few months' time, they will know about us, definitely.
Exactly. Thank you for that. Now I'd just like to give the opportunity to Dr. T and Celestine, who have just joined us, perhaps just to introduce themselves. This is like a very open conversation, so we just like to know who's on the call with us today, and also feel free to contribute to this conversation. But over to Dr. T and then Celestine, just for a quick introduction.
Hello, thank you very much. My name is Dr. Takarani Matsvandila. Basically, I was just listening. I will be able to participate next time. Thank you.
Okay, no problem. Thank you so much for joining us, Dr. Takalani. We really appreciate it. And over to Celestine.
Good evening from Kenya. My name is Celestine Todosia. I am a Rural Seeds Deputy Ambassador, the African region. I'm so glad to be part of this discussion. We've had a series of this discussion of rural proofing. The last time we had for Kenyan region and the North America, and there have been very nice discussions, and yeah, the discussion should keep on. I am a young nurse and I'm so happy to be part of this group.
That's amazing. Thank you so much for joining us, Celestine, as the Deputy of Rural Seeds Africa. And we also have another nurse in the room. We're also joined by Tato. So it's really great to have two young nurses on this discussion today. All right, so our next question is going to be focused more on the social determinants of health, and just focusing on what is the role that the health sector can play in addressing the social determinants of health, specifically in rural areas. And I'll just start off with you, Dr. Asafika, but what do you think is the role that the health sector can play in addressing these social determinants of health, particularly in rural areas?
Okay. I'm just thinking of an example I know from my community. So I'm from a very small town in the Eastern Cape called Flagstaff. So as with any small town, there are those adjustments that are made or implemented by government, assuming that that is the need of the community. So you will have libraries being built, you will have town halls being built, etc. So the town hall will be more utilized than the library, obviously, because people are not worried about reading a book at that point in time. They're just worried about employment. And that just goes to show that sometimes when you do not engage the community on what you feel is their most urgent need, and addressing the determinants according to assumption, most of the time you can actually go wrong. So that was just an example that just came to mind. So how do we address it? So I think, first of all, you engage the community. I believe so much in engagement. I take it as a form of consent from the community to say you can go ahead and do whatever change you want to implement in the community. So you engage the community and you move hand in hand with them. And how do you do this? Then that's when you will do what we call a community diagnosis to find out what is the most pressing need of that community and then address it. But it's also very important that you empower the community in a sense that, say, for example, I'm currently working in Mamelodi, which is quite riddled with substance problems. So one of the things that were implemented by the university I'm currently affiliated with is engaging the community. And they said, no, substance use is a huge problem. So we would really like for you to address this one particular problem, and then the rest you can see with time. So then they developed community-oriented substance use program, which helps to rehabilitate patients, but on an outpatient basis, not in a rehab. And that's one of the things that is helping the community that I'm currently in. And one of the things that helped is that they engaged and they found out what was the pressing concern. So I think when we want to address these determinants of health in these communities, it's important to not leave out that element. Of course, we can have our own objective concerns as health professionals, because I mean, if I'm working in an ED and I know that there's trauma every Friday, or there's trauma every Saturday or whatever because of high alcohol use and all of these things, I may feel that it's important that we prioritize lessening violence in the community, or I may feel that it's important that we prioritize shifting resources towards EDs on weekends because the burden is quite high, but the community may feel otherwise. So I think it's important that we strike a balance between these. Yes, it's important that we address what we feel is of concern, but also engage the community on what they feel is a concern, and then tie these two together and address two things at the same time.
Exactly, because sometimes what we think is important might not be what the people we're serving might not be what they think is important. So it's so important that we strike a balance. And Tendo, what do you think? What's the role that the health sector can play in addressing the social determinants of health? Tendo, can you hear us? I think you're still unmuted. Okay, it seems that Tendo is unable to answer us for now. But just to hear from Dr. Isimen-Min, what do you think, sir, what's the role that the health sector can play in addressing the social determinants of health, particularly in rural areas? And we'd particularly love to hear from a Nigerian perspective on the social determinants of health and the role that the health sector can play in addressing these. It seems that Dr. Isimen-Min is also unmuted, or perhaps he can't hear us. But does anyone want to answer the question? Please feel free to just give us your perspective on what you think the role is that the health sector can play to address the social determinants of health.
Okay, I'll just jump in right there.
Sure.
I think as the health sector, what we can do to address the social determinants of our rural communities, first of all, we need to learn from each other. We need to learn from the communities, and the communities must also learn from us. What do I mean by that? If we prioritize finding out the needs of the communities, studying what they use for specific things. For an example, I can say, where I work, you'll find that a clinic is operating Monday to Friday, and then on weekends, the clinic is not open. So you find that during the weekend, someone might be sick, and the communities that we are serving, from an African perspective, you find that they can use other indigenous ways of trying to resolve whatever they are having at that moment. So it is very important for us that if we learn from them, what are they using? What have they used? Collaborate with health institutions, and also to find out how safe are these? Have they been tested? And also we can also learn a lot from that. So for an example, there was when I was still studying in the University of Pretoria, there was a program in which they were doing a study where they went to a community and were liaising with a community traditional leaders, more in particular the healers, to find out what do they use for specific diseases, working hand in hand with them, providing laboratories to test that. So I think in addressing those social determinants, it is us bringing those services to the community, and also health education is the best way to start. Health educating our patients is, I believe it is a very good way to set the foot of this thing. Thank you.
Yeah, and just a follow-up question on that, you mentioned health education. And I know we've been focusing on the health sector to, address the social determinants of health. But do you think other sectors are involved as well in addressing the social determinants? And if there are other sectors that should be involved, like which ones do you think are other sectors that, are quite important to address the social determinants of health?
I think also the agricultural sector might play a role in terms of the kind of nutrition that this specific community is adapted to. So the agricultural sector might play a very vital role there. And also I think one of the speakers who was speaking here mentioned the innovative ways that they are using, and the device, or rather the app in which they are testing out now. I think also involving the technological aspect, it's also important in helping our communities. Yeah.
Yeah, and Nopinki, would you perhaps just like to expand on how technology and innovation addresses the social determinants of health, or how it can be used to address the social determinants of health?
I think from our perspective, issues like access, for example, it will be addressed, it highly addresses it, and issues of, I would say, cost, the cost element of health, that is, in fact, it offers a room to be able to manage the cost as element of it in a downward kind of way. Because it's not we're not the only player. Obviously, there are other factors. It might not be as we would like it to be, but definitely on a road towards playing that role. To also meet the Sustainable Development Goal number 3, it's very important, and time is not on our side with regards to that. 2030 is not too far from now, and technology can really definitely expedite the means of meeting those goals. It's very important. Everybody has a right to health, but there are factors that prevent people from being able to access that. So technology is one of the ways that can bridge that gap, and that is why Remote Doctors for Africa is at the forefront of trying to do that.
Brilliant. Thank you so much. And does anyone else perhaps want to add their comments on the role that the health sector or other sectors that we have, the role that they can play to address the social determinants of health? Celestine, definitely.
Yes, once again, I'm Celestine Todosia. So I'll just want to echo what we had previously discussed on the rural proofing. We had divided the roles into three, or what we can do to improve rural health into three. That is the community, the training institutions, and the health workers. But I would like to add a fourth one, that's the government and the health sector, the Ministry of Health, that is. So in the past, we start with the training institution. We say that you are a product of your training institutions. So you find that in the training institutions, the prioritization of other specialized areas, like it has really been made higher than the rural health. So you find the students or the products of their training do not want to go back to the rural areas because the rural health has been made to be some sort of a minor, or it's minor than the rest. So the institution should work hard on training and encouraging their students and just bringing in mentors that will give them the benefits and the advantages of working in the rural sector, because it's not a bad area. It doesn't mean that you are a minor specialist or a minor doctor or a minor nurse if you work in the rural areas. It's just the calling or the serving of serving the patients in the rural areas, just as like serving those in the urban centers. And then the second one is the health workers ourselves. Are we willing to work in the rural areas? Because most of us would want to work in the urban areas because it looks fancy, but we forget our first calling of serving our communities. It is a calling to heal, or to help people heal, or to get rid of diseases. Are we forgetting that first calling that we had, such that we willing to want to work there? We want to work in the urban areas that looks more fancy. And then the third one is the community themselves. Are the communities willing to embrace our doctors, or are they friendly enough to welcome the health care workers who are working there? Or are they willing to change their beliefs of they are not, it's not necessary they go back to the traditional way of healing, but welcoming this new era of new medical services? So that's the third one. And the fourth one that I want to add is, which is very pivotal, is the health, our government, because you find that especially in the African region, our political say is very important. And if our government do not put strong policies and strong implementations of these policies on what can happen in the rural sectors, are there affirmative actions to make sure that there are enough healthcare workers in the rural sectors? Are the rural sectors made to be comfortable enough for the healthcare workers? Because we find that healthcare workers should not find it as a sacrifice working in the rural areas. They shouldn't feel that it is sacrificing the good lives to work in the rural sectors. So we asking the governments to make sure that those areas are good, the roads are good, the network is good, especially for the young healthcare workers who would want to not to be in an area that has network. So let's make sure that those areas are comfortable for them. And also for the pay, you find that those areas are also, they're already hard. So let's give them incentives just to motivate those healthcare workers who want to work there. It shouldn't be a sacrifice. It should be comfortable. Yes, that's my take.
It's like you're reading my notes, because I was actually going to ask, like, what can attract young people of our generation to work in rural areas? But I see you've already jumped ahead to that question. But thank you so much for kicking us off with that. Perhaps if I can ask Mandisa like someone who's doing their 4th year, this is your final year, do you think you'd work in rural area? But just as our generation, what would be more attractive to lure you into working into rural? Like, you know, something that could be implemented and then you'll be like, okay, I'm definitely going. What do you think?
So for me, I've always been attracted to working in rural areas because that's where I grew up in, and I want to improve the state and being able to advocate for my people per se. But what I've heard from my peers say about like working in rural areas, what they don't want is because of the roads, as the previous speaker said, because of there's no shops, there's no clear near shops, there's no like shops to buy clothes, or you have to travel long distances. They don't like walking and all those things, and the houses are far apart, and there's less things that are accessible to them, and there's no like attractions per se to them. There's nothing luring them to work there. If you don't have a passion and there's nothing attracting you to the place, it decreases your chances of going to that place.
And in your curriculum, like at UKZN, is there something particularly being done by your institution to like encourage people to work, to go into rural?
I'm not encouraging, but we are exposed to rural areas. Like we get blocked, we get sites where we have to go to, which is in like deep rural areas where we're forced to go there. I think it would help with experience and seeing that they also need our help, exposure, that this is like a good thing to do, like good place to help and make a change to people of every culture and every socioeconomic status group.
And exposure actually plays like such a big role, because by giving someone that exposure, you don't know what it's doing to them. You don't know like what connections they're making and, you know, what realizations they're coming to. And just by doing that, like it plays such a big role as to whether someone eventually chooses rural or not. So I think UKZN is doing something really amazing by sending their students off into those deep rural areas and giving them that exposure. But Tato, you're a young person who works in rural. So what attracted you to go into rural, and what do you think would be more attractive to young people to get them to work into rural areas?
Okay. Frankly speaking, the rural area chose me rather than me choosing it, because I was placed in the place where I'm working by the placing system for the concept. So working there in the rural has been eye-opening, and it has been very fruitful because you get to learn and meet different kinds of people and from different socioeconomic backgrounds. And I think one of the things that would attract young people to work in rural areas, like I mentioned about the technological innovations, if it is ensured that there is access to network in the rural areas, the network is not a struggle. You find, for an example, I've seen where I'm working currently, we struggle sometimes with network, whereby you need to call an ambulance and you can't get through because the network is just not favorable. So I think that's one of the things, and allowing technology to run our institutions. I think it's gonna be one of the things that would attract our young people, because we grew up in an era whereby we have been exposed to technology for most of our childhood and our young years. So technology also will play a vital role there, and again, to attract young people to the rural areas, I believe we have to make it fruitful for them to come in terms of the packages they get there and everything, because you find that a young person is considering working in the rural, but first of all, you are moving from an area where you grew up to a rural area, maybe in another province. And when you get there, first of all, there's no accommodation there. So those are one of the things that would demotivate our young people. No access to transport there. The working hours are also not flexible. The working condition just doesn't allow you to work comfortably in a rural area. So I think also our government can play a huge role there in ensuring that the young people have access to the resources that they will need to work comfortably in a rural area. Yeah, that's my take on that.
Thank you for that. And Tendo, your hand is raised. You can go ahead.
Okay, hi. I'm sorry about earlier on.
No problem.
Yes. So, okay, just to answer maybe quickly, briefly on the previous question that you had, you know, my take from this is we need to go back to the board as the health sector. We need to figure out what is it that we're doing wrong. Of course, yes, we are doing something right. You know, we are trying to put up clinics and outreach services to our communities, but what are we lacking? What does this entail? What more must we put a structure? And yeah, I think that's something we need to consider. What are we doing wrong? What more can we put into this whole thing? You know, because if we are still having communities that don't have knowledge, and you know, someone can sit with for example, a diabetic foot and think it's okay, you know, that just reflects back on us to say, what is it that we're doing wrong? How can we fix this? So, and then as for the young professionals, how do I attract, you know, young professionals to consider working in rural platforms? I think the first thing should be passion, you know. That's the first thing for me, because if you don't have passion for helping, then you will burn out and tire very easily from those settings, because let's face it, we're not going to have everything fixed overnight. Some of the things you just have to make them work. So that's the first thing that we need to have. It's the passion for going into rural health. And from the other side of, you know, the other stakeholders and the government is try and make everyone as comfortable as possible. I think the previous speaker spoke about transport. You know, you're placed in a clinic, you're supposed to do outreach services or home visits, and you don't have transport. That is really demoralizing, and especially if you have to sit and think there's someone that you need to go out there, but you can't. And such things, resources. I think resources is the other thing that they should need to look at. We need to have resources. And yeah, of course, with the resources, it entails a lot of things. Accommodation, you know, you're taking someone from, say, KZN to come and work in Limpopo, for example, you need to accommodate them so that they can do what they do best. They need to be comfortable and have access to resources. You want to perform a very, very minor procedure for someone that doesn't really have to go to the hospital, but you can't do that because you lack even the most basic resources that you need in the clinics. And that is frustrating. You end up not seeing the purpose of why you're there, or are you bringing about change in that person's life. So it's a two-way street, you know, that we need each other halfway and work together to attract and this goes back everywhere, back to the universities as well, that we need to advocate for rural health even while they're still studying, to say, guys, the most you can do is just right at the core of the problem. Not, yeah.
Exactly. Thank you for that. Sorry, you can go ahead.
No, yes, I was done. Sorry, I think I need to put my hand down.
Okay, no problem. And Asafika?
So I just wanted to share one perspective from myself as a doctor, why I feel that, many professionals probably don't want to work in rural areas, and they should, because I think I'm excited about the future of rural healthcare when we start having platforms of this nature. So, as an intern in one of the Johannesburg complex hospitals, if you, as a doctor, did anything that was considered to be almost negligent, you would be dubbed as a Bundu doctor. They would say, why are you practicing Bundu medicine or anything like that? Something that stigmatizes a doctor that comes from a rural setting or is working in a rural area, which is not nice, because those doctors are the same people who have sacrificed so much, their livelihoods. There aren't any good schools available there. And this person is working in an under-resourced and understaffed facility, and they have to make do with what they have. And, you find that when you are trying to assist a patient and, you refer to a facility closest to you or whatever, when they see all these means that you've been putting together under frustration, they dub them as primitive methods and all these things, and you are now stigmatized. But at the heart of what the doctor was doing was to help the patient. So I think there's a huge stigma attached to working in a rural setting. So I think that needs to be changed in order for, a lot of doctors to find working in a rural area attractive once more. So how can that be done? I think, firstly, when clinical trainings and education and continuous professional development is encouraged and motivated for on behalf of those doctors, it can make a huge difference. And I think that research facilities and support should be taken to those institutions, because they do a lot of things that are unheard of. Some work, some don't, but the ones that do work, I think they need to be written about and contribute to the base of knowledge in medicine, so that they earn the respect with even the doctors that are working in urban areas, and not be dubbed or seen as people who are just going there because they're lazy, or because they don't want to work in a pressurizing environment, or because they just want to do their own thing, because there's all these perceptions which are so wrong, and I feel they need to be challenged. Yeah, that's the perspective I just wanted to bring forth.
Yeah, thank you for that, because you hear so many doctors in urban settings looking down on doctors that are doing, not doctors, sorry, health professionals that are doing really, really amazing work in rural, and they have little means to do this, but they still, make the most of what they have and still can make a significant difference. But it's about recognizing these health professionals, and I think we actually need a lot more of that. So thank you so much for that perspective. And this is going to be one of our last questions. But how do we ensure that good quality rural healthcare is accessible for people in rural areas? I know Nopinki might have a lot to offer on this point, because she's working in the technology and innovation industry. So perhaps I'd like to ask you first of how do we ensure that good quality rural healthcare is accessible to people in rural areas?
I think, as explained, through interventions like these, where the health sector gets to a stage where they're not afraid of technology, but rather embraces it and works with them, to make it sort of a normal practice to partner with such companies or corporates, because that is one of the most, I don't know what other I can put out there, one of the most, and also with the pandemic, one of the practical methods of making sure that health is accessible to rural communities. And as Tato mentioned, network as well, you know, is one of the, sorry, I don't know what's happening.
Sorry, Tendo, I think your mic is on. Would you mind muting yourself?
Okay, I'll continue.
Right. Yes,
As Tato was saying, to also ensure that network is addressed, roads, that's something that maybe only government can address, but as one, if I can mention 3 top things that have come up from the panelists in this discussion here this evening. So from my perspective, technology definitely number 1, and cutting edge quality health being brought to rural communities through interventions like bringing mobile clinics that is fully equipped with cutting edge equipment to make sure that health is brought, and having that infrastructure or ecosystem that, as I've put it forward, that makes sure that all those other auxiliary medical services as well are available through interventions like our Remote Doctors for Africa application that we are putting out in the market called OKDoc. Yeah, that's my contribution.
Thank you so much for that. And perhaps Celestine, just to bring you into the chat again, but what do you think could be done to ensure that good quality healthcare is accessible to people who live in these rural areas?
I think we should make sure that there are enough well-equipped facilities in the areas, making sure that there are enough healthcare workers in those areas, accessible roads, basically the social things that basic needs that people need. So there should be enough clinics there, enough healthcare workers there. And in other areas, we spoke the other day about ensuring that if we have fewer specialists, especially, why don't we rotate our specialists from one place to another? If they cannot come to us, then let's have at least rotation of the specialists going in those areas so that they can have quality services. Yes, basically just ensuring that we have those facilities around the places.
Thank you for that. And would anyone else like to offer their input on how we can actually ensure this? Prof. Pat, just to bring you into the conversation, but what do you think are some of the ways that we can make sure that good quality rural healthcare is accessible to communities in rural?
Well, I think that I would support what's already been said, because I think those things are important. I think the one thing that perhaps hasn't been said is that perhaps CPD for rural healthcare workers needs to be quite specific, because I think that they have different needs to other people, and they're far away from resources, and traveling is expensive. And so I think, maybe the professional organizations need to make a special effort to make CPD available to the people living, the healthcare workers in rural areas, to ensure that there is continuous upskilling, and that there is, and so that obviously influences the quality.
And do you think do you think the content of the upskilling should be similar to in urban areas, or do you think it should be unique to a rural area curriculum, so to speak?
Well, I think that we would need to talk to the rural healthcare workers, because they know what their needs are. I don't think that it should be dictated to them. I think that they should use whatever forums are available to make sure that they get accessible CPD activities. I think that it's just not going to a lecture to collect a CPD point or a CEU. It's to actually translate that into skill, so that it better serves people. And it obviously the CPD should be presented by somebody who has experience in that kind of context, because my experience is that there are different issues. I mean, I have experience in rural and in urban areas, and both of those are quite different in terms of what occupational therapists are dealing with. So I think, I assume that it might be the same for other areas of practice.
Definitely. Thank you so much for that. And Tato, I see that your hand is up. You may go ahead.
Thank you. I think we as healthcare professionals, since we are the people on the ground who are dealing with our people on a daily basis, we need to put it to light and remind our government that the people whom we serve lack these kind of services. We need these kind of resources. We need this. It shouldn't only end at reporting and compiling statements on the things that we need. We also need to keep on reminding them that this is what we need. This is what our community needs. This is what will make us work more fruitfully. And also in terms of from the government side, I believe if they were to revise their policies and budgets in terms of the allocation of money to the healthcare sector, more in particularly the rural setting, I think that would increase the chances we have at delivering the best quality healthcare to our community and rural settings. Thank you.
Yeah, definitely. Thank you so much for that. Does anyone have any last comments that they want to give on how we can ensure that, sustainable, good quality rural healthcare is made accessible? This will be our final question for today.
I think, if I may, as mentioned by everyone, collaboration definitely is the thing to go. And as I think it was Mandisa mentioned, involving the people, the communities themselves, and just basically identifying the challenges and work towards bridging those gaps that are in the way, like to address those. Obviously, it's not going to be an overnight thing, but to be aware of what they are and in a prioritized manner, address them step by step. But collaboration definitely will get us there quicker.
Definitely. I think collaboration, especially with community members, because at the end of the day, we are here to service community members, but also empower them to make sure that healthcare really is sustainable and that we can secure a great future for rural communities by putting the power in their hands and making them realize that I'm a key stakeholder in my health, I'm a key stakeholder in the services that I access, and I'm a key stakeholder in this ecosystem of healthcare that is at play. So I think we've discussed quite a lot today about rural healthcare, rural proofing, and how we can make healthcare more accessible for people in rural communities, and how we can also make it attractive to young people. So it was really such an insightful conversation, and I was so glad to be listening to all that you had to share today. And thank you so much for joining us today. I'll just be opening up the floor for everyone to just give their last few comments, their closing comments that they have. It can be about rural healthcare, it can be about rural proofing, or any last few thoughts that you have for our discussion today. And then I'll start based on the names that appear on my screen. So Tato, any last comments, any closing comments from you?
I think whatever projects or studies that we do in the rural health areas, one of the most important things is to make the community fall in love with what we are doing, so that it will not be rejected and it will be accepted and embraced in order to deliver the best quality of care. Thank you.
Thank you so much. And Dr. Asafika?
So my parting shots are that active participation coming from the community is implied consent to say they approve and they are happy with what you have come up with. So if they aren't actively participating, maybe rethink whether they have consented internally or not. Thank you.
Wow, love that. Thank you so much. And Prof. Pat, any parting comments from you?
Well, I think that thank you very much for this conversation. I think it's been very valuable and quite insightful. So I would just like to thank you for that. And just to say that having listened to the conversation, I think people, well, in many areas have to concentrate on two things. The one is on service delivery and the other is on advocacy for services. And that for many people in the rural areas, advocacy becomes an important part of their daily activity, not only to the community, but to the politicians and to the healthcare planners, and that we need that, and that perhaps healthcare workers in their training need a little bit more expertise in
Prof. Pat, I think we're losing you a bit there. Prof. Pat, I don't know if you can hear us, but we can't hear you anymore, and your video is stuck. So I'm not sure if it's just on my side, but sorry, Prof. It was just cutting at the end there. So we didn't hear your last few sentences.
Yeah, sorry, the internet just dropped it just then, but I just say that I don't know where you stopped hearing me, but I did say that I thought perhaps that the education institutions could look at possibly including a bit more on advocacy and advocacy tools for healthcare workers to enable them to do the advocacy work that is really necessary to ensure quality services, and, you know, using these existing structures to make people aware of what the problems are.
Definitely.
So
thank you so much for that. I definitely think that educational institutions have such a big role to play, and in terms of the future health professionals that they deliver. So advocacy is definitely a big role that needs to be included in the curriculum. So thank you so much for that. And Nopinki?
On my side, I think I've captured my parting shots. Collaboration, access are key for me. And it was a great initiative. It's definitely very interesting things have come up and things that we need to sort of bridge the gap on our side, things that we need to focus on our side. So from my side, thank you very much.
Thank you so much for joining our conversation today. And Dr. Isimenmen, any closing comments from your side?
Yes, we'll be looking at intersectoral collaboration We are talking of agriculture, water resources, education. All this will help to reach the rural people and improve their health status. In addition to more category, the various category of health workers. The more we have on ground, the better for us.
Exactly, because at the end of the day, health is a multidisciplinary team, and all stakeholders need to be involved to make sure that all our goals are met. But thank you so much for your parting comments. And Tendo, any parting comments from you?
From my side, I think I would just like to say I was very impressed when I read the invitation that, there's actually people that are acknowledging rural health and actually embracing it, because every time when you go into the field, you just feel demotivated, like I'm alone in this and I can't do this, it's too much. So just knowing that, this is being considered globally, it's really refreshing. And I hope that we do not give up and we continue and bring about a change in the future. Yeah, that's what I want to say.
Thank you so much for that. I'm so glad that you feel like you're part of a community, like a global community of healthcare workers who aren't just and that you're not just advocating for rural healthcare on your own, but that there's a whole global community that's also supporting and advocating for the same things that you are. So I'm so glad you were able to meet more of your community members today through this platform. And thank you so much for joining. And Mandisa, any closing words from you?
Firstly, I'd like to say that I'm grateful for being part of such. It was very insightful and it makes me confident, and it grows my love for community, making sure that I'll be making a change, going out there, and I'll be impactful to other people.
Exactly. And you're definitely like one of our future OTs, but also one of our future leaders in rural health. So we're really rooting for you, and we really hope that you stay in rural health, and that your passion for rural health just grows and grows. But thank you so much for joining us today. And Celestine, any closing words from you?
I'll say that rural health is very important, and if rural health is advanced, everyone benefits. I will also say that the healthcare workers that work in the rural areas are no less than those that work in the urban centers. They're all the same. So let's make sure that our rural health is advanced and everyone benefits from it. Thank you.
Thank you so much, Celestine. And we know that as our rural seed, our deputy rural seed for the African region, you'll definitely be making sure that rural healthcare doesn't take the back seat in conversations, and that people know the importance of it. So thank you so much for all the work that you're doing. And with that said, it brings us to the end of our conversation today. It was so insightful. I really had no idea the leaders and the impactful people that I was going to be speaking with today. But you've really opened up my eyes up to what rural proofing is and the power that it has, why it's so important, and also how we can make rural healthcare more attractive, more sustainable, and more empowering. And just to comment on what Tendo said of like a rural community and not feeling isolated and alone in this fight for rural healthcare, I just wanted to alert you guys to the Rural Doctors Association of South Africa, RUDASA, as well as the Rural Rehab Association of South Africa. So RUDASA and RURISA are basically organizations that are that are made up of either doctors on the doctor side or people in health and rehab. So we have OTs, physios, basically all health professionals that form part of these organizations. And the role of these organizations is to advocate for rural healthcare on both a national, provincial, and a local level. It's also to support, it's also to mentor, but it's also to upskill, especially with what Prof. Pat mentioned of like CPD points and making sure that health professionals are constantly upskilling. So currently RUDASA is hosting like a 6-week program to upskill doctors and their knowledge and key competencies that they need to know when in rural healthcare. So please learn more about RUDASA and RURISA based on the group that you fall into, and also join, be part of them, know what's happening in there, join the groups, listen to the conversations, and just be part of that global community, and definitely South African community of health professionals in rural, so that you don't feel alone and that you can feel like you're actually part of this community. Yes, but thank you so much to everyone for joining. I really appreciate you all for taking time out of your busy days and making time for this conversation. It is definitely much appreciated. And as much as it was insightful to us, I'm pretty sure that it's going to make such a huge impact in the research that Prof. Ian and his team are doing. So thank you so much for that. And if you haven't yet signed the consent form, please may you sign it and send it back to me. I'll also be sending it to Nopinki as well, just so that your consent is noted for the research project. And then you can, please may you just drop your email in the chat room before you leave the meeting. And thank you so much to everyone. And as well as to Dr. Isimenmen and Prof. Pat, please may you also just drop your email addresses in the chat box, just so that we can send the consent form to you as well to complete. But yes, everyone, that leads us to the end of our conversation today. Thank you so much. Please feel free to reach out if you have any questions regarding the research project, in terms of the findings, in terms of the research paper, or anything at all regarding rural health. Please feel free to reach out. And thank you so much. Yeah, thank you. Bye.
Bye. Thank you.
Thanks, Putlali. You were amazing. Bye.
Thank you so much.
Harry, can you just stay for a minute after everybody has exited? Maybe you should stop the recording from your side. Great.
I forgot.
Anyway, it's okay since we're not recording anything. So yeah, how do you think that went?
I think it went well. I think it was insightful. Yeah, I think it was a good conversation. I think people were